Hello, this is a short explainer video showing you how to use the Isopharm Surgery Checklist Compliance Logbook. Completing our logbook helps you to comply with HTMO 105 in England and Northern Ireland, SDCEP in Scotland and WHTMO 105 in Wales. Step 1. Filling in the front cover. You will need to enter your practice name, the surgery number or surgery name if you prefer. You will also have to enter the start date of the logbook. The end date should be completed after all 12 months of record keeping have been used. Step 2. Now you need to record the details of the practice manager and the staff responsible for clinical duties. The radiation supervisor and radiation operator should also be identified here. The location of your significant incident book should be noted as well. Finally, enter important external contacts such as occupational health, local accident and emergency, plus safeguarding contacts. Step 3. The Guidance section. This is a new feature of the Isopharm logbooks and is intended to provide guidance relevant to the surgery. The guidance is split into two sections. The first is specific to the surgery. The first spread of the surgery guidance covers hand hygiene and provides a flowchart of hand cleaning techniques. The next page deals with personal protective equipment, including the order of PPE placement and removal. The next spread covers surface disinfection, including the use of alcohol-based wipes and spray bottles. Then comes the dental unit waterline section, giving an overview of biofilm formation, dental unit waterline quality and management, plus methods of maintaining water quality. Then the guidance covers pouches, trays and transportation, including details on transport boxes, plus storage periods for decontaminated instruments. Next is sharps injuries, which includes the management of bloodborne virus infections from sharps, plus what to do in the event of a sharps injury. And finally, this section covers hazardous waste, including waste legislation and policy, plus a chart highlighting waste segregation. The second section covers additional guidance that may be required. The section starts with safeguarding, what safeguarding is, plus what to look for and how to record evidence. It also shows a flowchart showing the 5 R's of safeguarding. The guidance then covers the Mental Capacity Act, explaining decision-making, assessing capacity, best interests, and a flowchart showing the 5 principles of the Mental Capacity Act. Next is medical emergency and first aid, which provides details from the Resus Council and Health and Safety Executive, with a flowchart detailing what to do in certain emergencies. Then comes the spillages section, which features details on what to do in the event of bodily fluid spillages. The next spread deals with environmental maintenance and cleaning in the dental practice, plus full details of the National Colour Coding Scheme for primary care and dental practices. This section also includes computer infection control, showing the differences between clinical and non-clinical areas and the differences between washable and non-washable keyboards. The final spread deals with whistleblowing and highlights the General Dental Council standards, practice policy, the manager's role, and a procedure flowchart. Step 4. This is where you do the record keeping. Tables should be completed as checks are performed. The daily record sheet is split into 3 sections: preparation for the clinical session, during clinical session, and end of clinical session. Only one section is provided for during a clinical session, and this should be used as a spot check because it is not feasible to record details for every session. Only the person carrying out the task should initial that it has been completed. You should not backdate records, and do not initialize if the task has not been carried out, as this would be interpreted as falsification of records. Once per week, the practice manager should sign to state that the logbook is being completed correctly and that the spot check has been performed during a session each day. Step 5. Safeguarding. Record sheets for recording facial injury can be found at the back of the logbook. As well as drawing on the facial diagram, enter a description of what you have noticed and recorded. When completed, the page should be removed and stored in the patient's records. Only facial record sheets are provided for use within the dental practice, rather than full body records. Step 6. This section of the logbook is for you to gain Non-Verifiable CPD from the Guidance section. Each question is based on a subject from each chapter. Simply fill in your answers and add to your personal CPD portfolio. Step 7. A unique feature of the Isopharm logbooks is the bookmark. This should be used to keep your place within the record sheets. The reverse of the bookmark features details of our online verifiable CPD and relevant products which can be purchased from the Isopharm webshop. Isopharm logbooks create a practice-wide compliance system that provides you with complete and comply record keeping, essential guidance, non-verifiable CPD, and total peace of mind. Thanks for watching this video. If you have any questions or require any advice, please ring free phone 0800 840 0105 or visit the Isopharm website.